Welcome to The Explainer. Today we're diving into a really important topic, violence against healthcare workers. We all know it's a huge problem, but what if you could actually put a price tag on it? Well, a new study published in the Journal of Women and Child Health does exactly that. And the number they found, it's about so much more than just money. It's about the quality of care we all depend on. Let's break it down.
The researchers themselves summed it up perfectly. When the people who are there to heal us are facing violence, they might not show up for their shift, or they might just quit altogether. And what happens then? Hospitals are short-staffed, and that means patients, even sick kids, get their treatment delayed or don't get the care they need at all. It's a devastating chain reaction.
So let's start with the problem itself, this unseen crisis. Workplace violence in hospitals isn't just some rare, shocking headline. No, it's a global issue. And it really boils over in these high-stress environments where, emotions are already running sky high.
Now, this study zooms in on Karachi, Pakistan, to see what's happening on the ground. And what they've found is pretty alarming. The violence is most common in the most sensitive places you can imagine, pediatrics and gynecology. Just think about that. The very specialists caring for our sickest children or for new mothers are the ones facing hostility while they're trying to save lives.
Okay, so we can all understand the emotional toll, the human cost of this. But the researchers wanted to ask a different, really specific question. What is the actual financial price of all this violence? How much is it costing the healthcare system in cold, hard cash?
So, to figure out that total cost, they broke the problem down into 3 key pieces. First, the cost when staff are absent, just not showing up for work. Second, the cost when they quit for good and have to be replaced. And third, and this is absolutely critical, the cost of what happens to patient care when it starts to suffer.
And where'd they get this information? Well, this wasn't just theory. They went straight to the source. The research team conducted this huge survey, talking directly with over 400 doctors, nurses, and other staff across 14 different hospitals to see what was really going on.
And this brings us to the core finding of the whole study. The big reveal, the number that really crystallizes just how big this crisis is. So, after crunching all that data from those 414 healthcare workers, all the missed days, the resignations, the errors in treatment, what did they discover? What was the final number?
Get this. The total cost is nearly 25 million Pakistani rupees. That's about 90,000 US dollars. Every single year. Now, for a healthcare system that's already facing shortages and stretched to its limit, that is a staggering amount of money just vanishing into thin air. But here's where it gets really, really interesting. When you look at where that cost is coming from, it's not what you'd expect. The biggest expense isn't from people quitting or calling in sick. Nope. Almost half of that entire 25 million rupee figure comes from something way more alarming, a major drop in the quality of care that patients are receiving. So let's dig into that. Let's look at what each one of those slices on the chart really represents, and we're going to start with the biggest, most impactful one.
This is the hidden cost. And honestly, it's the most devastating one. When medical staff are stressed out, when they're scared, or when they're just completely overworked because their coworkers are gone, they can't provide the best care. It leads to mistakes, to delays, and to patients who aren't getting what they need. And that directly impacts people's health and the hospital's finances.
The next big cost is staff turnover, and this causes that long-term damage. See, every single time an experienced doctor or nurse quits because they just can't take it anymore, the hospital not only loses their skill, it also has to spend a fortune to find and train someone new. It's this constant churn that can destabilize an entire department. And finally, you've got the most direct cost, which is absenteeism. After something violent happens, a staff member might be physically hurt or just too stressed and afraid to come back to work. And what happens? A shift goes uncovered. That puts immense pressure on the people who are left, and it just creates this vicious cycle that puts patients at risk.
But here's the best part. Putting a number on the problem is just the first step. The real power of this research is that it doesn't just leave us with the bad news. It gives us clear, practical steps on how to actually fix it.
The researchers laid out this really smart, multi-layered approach. It's not just about, let's hire more security guards. It's about actually enforcing laws that protect workers. It's about training staff to handle tense situations. It's about giving them safe ways to report violence and providing the mental health support they obviously need. It's a whole blueprint.
So here's the bottom line.
The big takeaway from all of this: investing in the safety of healthcare workers isn't an expense. It's an investment, and it's one with a huge return. By protecting staff, hospitals save money, they keep their best people, and most importantly of all, they provide better care and they save lives.
So really, this study gives us both the diagnosis and the cure. We've got the hard data that proves the problem is real and a clear plan for how to fix it. The only question left is the one you see right here. How can we make sure that the people who dedicate their lives to protecting our health are protected too?